everyone. My name is Dina Vanderzalm with Missouri Rural Crisis Center, and we're here for one of MRCC's Medicaid Minutes. We wanted to come to you today because there were some recent changes in October that are impacting people who receive home and community-based services on Medicaid. So we brought Jamie Rodriguez from Legal Services of Eastern Missouri to help us talk through what some of these changes are to the HCBS community and what we think the impact will be. So Jamie, if you want to take it away.
Yeah, hi everyone. Thanks for having me here. So as Dina said, I work for Legal Services of Eastern Missouri, or LSEM. We're a nonprofit law firm and we provide free legal services to low-income people. And I specialize in Medicaid benefits. And I wanted to give you some important information about changes to Missouri's Medicaid program. The changes, as Dina said, are happening within the Home and Community-Based Services program. Home and community-based services are a type of Medicaid benefit that provides care in your home. The services are for people who need a skilled nursing facility or nursing home level of care. So to evaluate your level of care need, the Department of Health and Senior Services will come to your home and do an assessment. The assessor will ask you a series of questions to learn more about your needs, and these assessments occur when you first start getting HCBS and then every year afterwards to kind of check in, reassess, make sure you're still eligible. The Department of Health and Senior Services, which is the department that runs this program, they started working to update and modernize the assessment process in 2018, but that process was delayed because of COVID-19. And the changes that they have been planning for a long time finally went live in October of this year. And when they came into effect, the department changed the way the assessment works behind the scenes. So if you've done it before, the process and even the questions being asked will seem basically the same, but the answers are going to be weighted differently and the scoring has changed, both in the categories that are important and in the way that the points are assigned. So because of these changes, we expect there will be people whose eligibility changes, even though their needs have not changed. They did not get better. Based on conversations with home health providers and also the independent assessment of a consulting company that the state hired, we are anticipating about 15 to 20% of people who are currently on services will be found ineligible. If the department decides you are ineligible for HCBS, either at initial application or at reassessment, you have the right to an appeal hearing, and you don't need a lawyer for that hearing. So my goals today are, number one, to make you aware of this change and how it might impact you, to share some tips for making sure your assessment accurately reflects your needs, share our toolkit, which we put together that has information about appeals, and make sure you know how to contact legal services if you have questions or need help. Although we are Legal Services of Eastern Missouri, we're happy to talk with anybody statewide about this problem, no matter what part of the state you're in.
Yeah, and you've got a network that you can refer people to for more local help if they need it.
Absolutely.
So let's jump into some of those tips. You said we're anticipating this pretty significant drop, which will obviously impact a lot of folks in rural areas. What advice do you have for folks when they are doing that assessment piece?
Yeah, so our biggest advice is this is your chance to give a really realistic assessment of what you can do for yourself. Many people have fluctuating needs from day to day, good days and bad days. So remember to describe the assistance that you need on your worst day in the period of time the assessor is asking about. Many of these questions will say, in the last 10 days, have you had this issue, or in the last week? So listen for that time period and really think about it before you answer, and try to think if you've had any challenges on a day in that period, even when maybe other days were better. Another really important tip is that you need to be really honest and share as much information as you can, even though some of these questions might feel uncomfortable or embarrassing to respond to. So remember that these questions, which sometimes are about things like, do you need help going to the bathroom? Are you able to bathe yourself? They're not meant to pry, they're not meant to embarrass you, but to be sure that you can get the help that you need to stay in your home. So give information, even though it is understandably hard to have these conversations with a stranger. If you don't understand what a word means or what the question is asking, you can tell them that and ask them to, rephrase or explain it to you. You can ask what the possible scores are and what they mean. So, for example, on questions about things like bathing, using the toilet, and moving around your home, those are called activities of daily living. The possible scores are 0 for independent, 1 for setup, which means you need help setting things up and then you're good. 2, supervision. 3, limited assistance. 4, extensive assistance. 5, maximal assistance. And 6, total dependence. So I share that example just so you understand that the scales they're using might vary from question to question, and it's good to understand what they're thinking about, even if that's not in the question they ask you. When you're scheduling your assessment, let the department know if you need any disability-based accommodations or things like a sign language interpreter or an interpreter if you speak a language other than English. You can also ask for somebody to be present with you, like a family member, a caregiver, an advocate, or a legal aid attorney, and that person can help you answer the questions. If you want to answer some of the questions privately and have that person step out for some questions, that's okay too. Don't give in to pressure to be rushed through the assessment. Take your time. Ask for a break if you need one. This is your chance to make your needs known, and you should take advantage of it and not feel like you have to help someone hurry to their next appointment of the day. Before the assessment, write down things that are important to say that you might forget in the moment. You might get flustered. You can do things like keeping track of falls or near falls or trips to the hospital. And if you're doing that, try to note the date, the time, and any details that you can remember. So those are a few of my best tips for being successful and getting an assessment that is accurate in gauging your needs.
Those are all really great. And then so if people, get denied or if they're found ineligible, or, want to at least share that story, you talked about, we're not totally sure what the impact will be. So really wanting to make sure we're capturing what the experience is for folks on the ground. What are ways people can reach out and get some extra help?
Yeah, so we have a dedicated email address that we created just for this issue. So it's hcbs@lsem.org. And you can reach out if you have questions about what's going to happen in general, or about your situation. We'll do our best to answer specifics about your situation. If we need to ask the department for information about your case file, we might need to get like a release signed or something, but a lot of things we can answer just generally. So we're happy to answer questions, talk through concerns, and really the most important from our perspective is problems, tracking problems. That is how we're going to know what the real impact is. So if somebody's getting cut off and their family's like, they definitely need that help, like that doesn't make sense. They're not going to be able to stay in their home without that help. We want to know about that. So anything you'd like for us to know, we're very interested in this. We've been following this issue and analyzing all of the different versions of the assessment since 2018. So this has been a long time coming, but now is kind of when the rubber hits the road and we really need the public to keep us posted. We've done as much as we can on our end. Now we need you to share your information with us about what you're seeing, what your personal experiences are.
Absolutely. And we have a link for the toolkit y'all have put together that really runs through the tips that you touched on, and some more detail. And we will put that in the comments, so people use that, share it. If you know folks, if you are, like helping a family member, a friend, we want to make sure people are as aware as possible. But thank you so much for joining us today, Jamie, for these great resources. And we look forward to working with y'all and making sure that we help as many Missourians as possible with this. So thank you,
Thank
everyone, for joining us for this Medicaid Minute, and we will see you on the next one when we have some more updates.